Hello students, this is Perio, Chapter 25, Lecture 1. What is motivational interviewing? It's a patient-centered method that strives to enhance the patient's motivation for behavior change by exploring the patient's mixed feelings about changing his or her self-care routine. The clinician's goal is to develop an understanding of the patient's perspective. In other words, you want to understand what the patient believes to be true and what the patient desires in life. What is the patient's point of view? Patients won't change their behavior just because you told them to. Patients don't like to be told what to do and can become defensive or tune you out. Motivational interviewing, or MI, is the technique recommended in your textbook. You want to treat the patient as a collaborator or team member who will work with you to achieve the goal that the patient wants to achieve. The four principles of MI are empathy, discrepancy, roll with resistance, and support self-efficacy. Demonstrate that you care about the patient. Engage them in conversation that allows them to freely express themselves, and don't judge them. Open-ended questions and reflexive listening are two excellent ways to express empathy. Listen for discrepancy between what the patient's existing dental condition is and the condition that they say they want to have. Acknowledge your understanding of the patient's expressed desires in your own words. I would say, have you considered stopping smoking? Roll with this resistance. Don't argue or try to make them agree with you. Affirm and acknowledge the patient's efforts. Validate the patient's strengths. Express appreciation for the patient taking the time to be in the dental office, being willing to discuss smoking cessation or taking some small step toward change. Encourage the expression by the patient of statements in the direction of change. The methods in your textbook are one way to speak to patients, but you will need to develop your own way of communicating. Recap on motivational interviewing. A patient-centered method that strives to enhance the patient's motivation for behavior change by exploring the patient's mixed feelings about changing his or her self-care routine. MI is a technique that uses a guiding style to explore the patient's mixed feelings about behavioral change. The MI approach sees behavioral change as a collaboration between the clinician and the patient. This concludes Perio, Chapter 25, Lecture 1.